for me this morning?
Absolutely. I have more than a minute if you need it.
You know, I have followers. I have people interested in what I'm doing. So I know that you are a psychotherapist. What does psychotherapist do, Dr. Diana?
Okay, well, psychotherapists do many things, but based on my experience, I think what the public can sometimes not be aware of is a psychotherapist, which deals with mental health, is different from a medical doctor, which is dealing with medical or biological health, physiological health, if you will. And what I mean by that is, if you go to a medical doctor and say you have a cough, well, the medical doctor can examine you and say, okay, you have a cough because you have the flu. And so you take this antibiotic and maybe you do this, and within a week's or so time, you're fine and life goes on. But mental health is never that easy, okay? People can't just come to me with a certain issue, problem. I can't just say, stand on your head, run around the block and drink orange juice and you'll be okay. There's no easy answers like that, because mental health has many, many different layers to it. And so they may come in with a surface issue that they're experiencing. Perhaps they hate their job. Their boss is a nightmare and their colleagues they just can't get along with their colleagues. Well, that's a very surface issue, which usually has a lot more layers to it, and it goes back to their innate personality and preferences, how their innate personalities and preferences have come to be based on past relationships, and even going back to families of origin, early life experiences, that all have something to do with what is making their present experiences at the workplace unpleasant for them, you know. And so there's no fast and easy answers when it comes to psychotherapy. Things have to be looked at in a very holistic fashion, and that takes time. As I always tell my patients, it's a marathon, it's not a sprint.
Lovely. Thank you. My other question is, so somebody discovered that he or she needs your service. So how do you handle a patient?
Okay. There are many different theoretical orientations and modalities to psychotherapy, okay? Myself, I operate from what is known as psychodynamic psychotherapy, okay, which is also known as depth psychology. So again, I am looking at more deeper layers, not just what seems to be the presenting problem or issue, but what else is going on with this person. What is their innate personalities? What are their past experiences that all culminated together that is making whatever the presenting problem is an issue? I'm also a certified dance therapist and expressive arts therapist. So I also patient dependent, because there's no one size fits all in here. But I use many different modalities in my work other than just verbal therapy. But again, it's all patient dependent and what is right for the patient.
Thank you. You know, we've just been through years of COVID pandemic, and it has affected many lives. You know, I myself had a friend who lost families, and it was very depressing. How has COVID-19 affected people around the world?
There's no one answer for that. I think it's fair to say that it has surely affected every individual on planet Earth in some way, especially during those 2 years where it was really super big, okay? People were under house arrest. People were not allowed to go to restaurants. People could even go to stores or walk down the street just one by one. You couldn't even walk with your family or your partner. And it's different with everybody. But I think it's fair to say that it definitely, to some extent, had some negative impact on each individual. And simply put, because we were under house arrest and we were very restricted from doing a lot of the things, hobbies or working in the office that help us express ourselves. It's our livelihood. It's our joy. It helps us express ourselves as an individual. And that was taken away from us to some degree. And whenever we can't express ourselves through our passions and our livelihoods, that's going to cause some level of depression. Through our passions and our livelihoods, that's going to cause some level of depression to some extent. And so, yes, we all suffered to some degree under COVID. And we still many people haven't totally come back to life because of that. And again, it's different from person to person.
We don't want that back, do we?
Oh, absolutely not. COVID is here to stay, but I hope the ramifications, lockdowns and all of that are gone for good.
Yeah, that clear, how people have been reacting to that pandemic.
And as you know, my work also includes working with a lot of young children. And what I have noticed is the young children who were like toddlers during the COVID lockdown time, and, they were at the age where they were developing gross motor skills, walking and whatever. And because they were locked inside and couldn't go to playgrounds or run around, it has caused a lot of physical development, difficulties with young children. Also, research is being done on, or has been done, with how wearing masks have affected young children, where they didn't learn to see each other's facial expressions or body language. And that has I can go on and on and on. I'm just giving you a couple of examples about how it's negatively impacted.
Thank you. I believe that there will be a workshop on, I don't know the topic yet. I believe it's in the works, that you will be talking to a group of potential patients, who are from various backgrounds, looking to have who need help, who needed your help. Can you elaborate a bit more about the benefit of having a workshop or a group therapy?
Okay, as you have explained to me before, the nature of what you're looking to do on one of these mental health retreats, because we are going to be having participants from many different walks of life, different situations and whatever. I think such a retreat and workshop I would organize along the lines of rediscovering our authentic selves. Who are we? What were we like before COVID? And how did COVID affect who we are as an individual person? And how do I get back to my authentic self? What my passions were? What the family dynamic was that is perhaps different now. But also, having said that, without going into details, speaking solely for myself, there were actually blessings that COVID brought to me in my life, okay? And so that can also be addressed. Was there any blessing for you that COVID may have been to you? I mean, we all know there was lots of negatives involved, but perhaps there was a positive for somebody.
Will this workshop be a platform whereby the participants, after attending such workshop, will be able to get in touch with you and have a one-to-one,
Absolutely.
consultation.
Absolutely.
That would be great. There's a follow-up.
Right.
Okay.
Absolutely.
So that's lovely. Thank you, Dr. Diana. It has cleared some of the inquiries that my followers has been asking me about mental health, and the difference between psychotherapists and psychiatrists, so to speak. Thank you very much.
All right. Thank you so much. Thanks for having me.